Okay, we're going to pick up the topic of consciousness with those related to sleep and dreaming. About the noise. Remember that little exercise from class. Okay. Let me get past that as quick as I can. There we go. Sleep and dreams. Okay, so sleep laboratories around the world are helping us to unravel many of the mysteries that surround sleep and dreams. One of the techniques that is used in those is the polysomnograph. And this is a device that can track eye movements, muscle tension, brain waves, many other elements of our physical self. And as they do that, then they can observe changes in these areas as the person sleeps and also connect them with any observations that can be made. Now, our biological rhythms influence our sleep patterns, and particularly circadian rhythms. You'll see in that word circadian, circa, about the day, so about the same time every day. There are fluctuations in various processes and abilities that we have, and this is part of our body's biological clock. A couple of circadian rhythms that influence then our sleep patterns would be body temperature and level of alertness. Generally speaking, as our body temperature rises, we become more alert. As it drops, we become less alert. Body temperature begins dropping typically in the evening, and as it does, people become drowsy and want to go to sleep. In fact, it drops lowest 3-4 in the morning generally, and if you've ever tried to stay up all night, you find it pretty difficult to stay awake at that time, or at least more difficult. Body temperature begins to rise then in the morning, and people find it easier to be alert. And in the afternoon, we have a dip in body temperature after lunchtime, whether we eat lunch or not. And at that time, often people find that it is also more difficult to stay alert during that afternoon dip. Now, there are a number of things then that regulate our circadian rhythm when it comes to sleep, and one is exposure to light and darkness. When light enters our eyeball, it strikes certain receptors on our retina that then send messages to what's called the suprachiasmatic nucleus. It's part of our hypothalamus. When these signals reach the suprachiasmatic nucleus, a signal is created that is sent to the pineal gland, and this prevents the pineal gland from releasing melatonin, a hormone that leads to drowsiness. Now, when it gets dark, there is no such signal, and so the pineal gland receives no stimulation, and it begins to release serotonin, which contributes to becoming drowsy. Now, there are a few things that can interfere with this whole process, the circadian rhythm of sleep. One is jet lag. If we travel several time zones away from our usual habitat, when we get there, our circadian rhythm, our body clock, is out of sync with our environment. And so we may find ourselves wanting to eat when it's not mealtime there, wanting to sleep or wake up at times when it's not consistent with the time zone there. Now, in fact, this process that we talked about with the suprachiasmatic nucleus is one of the things that helps adjust our circadian rhythm then to our new surroundings. Another thing that influences this is the effects of artificial lighting, because artificial lighting also activates this process. It means that artificial lighting may keep us up when we'd rather be sleeping. And in fact, studies indicate that we sleep about an hour and a half or so on average less than our ancestors did, in part due to the effects of artificial lighting that's been invented. Now, in fact, that artificial lighting might take the form of light from a TV screen, a computer screen, even your cell phone screen. And this suggests, if you're having difficulty falling asleep in the evening, that you might discontinue the use of those components sometime before bedtime, hour or two before bedtime, and you might find that you indeed do become drowsy more readily. Now, they have identified various sleep stages. Again, the polysomnograph is one piece of equipment that's helped us to learn about these. Certain brainwave patterns then are associated with certain kinds of consciousness. Beta waves, relatively rapid, 12 to 30 cycles per second, are found when we are in an active mental state, concentrating, controlling our attention, or moving around. When a person is awake but relaxed, more relaxed, then we see the appearance of alpha waves, slower, 8 to 13 cycles per second. Now, normally this will lead to a transition into sleep, although what they have found is experienced meditators can produce a great deal of alpha waves without becoming drowsy. This seems to be sort of a learned skill that the practice of meditation has enabled them to achieve. Now, once we then begin transitioning into sleep, we enter what they call non-REM 1 sleep. And we see irregular brain waves at first, and then we also see the appearance of higher amplitude, higher energy theta waves, which are slower, 5 to 8 cycles per second. Theta waves are also found when people are daydreaming, and if you think about it, the experience of daydreaming and drifting off to sleep is very similar. Our attention drifts from one thing to another, and we become less aware of our surroundings. When people are falling asleep, also in non-REM sleep, they may experience hypnagogic hallucinations, which is actually perfectly normal. Now, the most common of these are the person feels a sense of falling or maybe a sense of floating. In some cases, these might be more distinct and vivid. The person might feel that there's someone present in the room when there's not. They might hear various sounds or maybe even a voice speaking. They might have visual hallucinations like you see on this artwork here by Mauricio Garza Vega. So these hypnagogic hallucinations are perfectly normal if they go away when the person is actually awakened. Now, when in non-REM 1 sleep, people are easily awakened. If they continue to fall more deeply asleep, they enter non-REM 2. And the brain waves continue to slow, although there are bursts of rapid brain activity that they call sleep spindles that occur during this time. The person is obviously asleep if we look at them, but we can still awaken them pretty easily. People typically spend about 20 minutes in non-REM sleep before moving into the deeper stage, non-REM 3. Non-REM 3 then, our deepest sleep stage, where we're least aware of our surroundings, where it's hardest to awaken us. Brain activity slows to the extent that delta waves appear half to 2 cycles per second. Eventually they become the dominant brainwave pattern, and the person spends about 30 minutes in deep non-REM 3 and then begins ascending into the lighter stages of sleep. It turns out that sleepwalking actually occurs in non-REM sleep. okay, non-REM 3. And so in the deeper stages of sleep. And that might account for why sometimes people do some kind of dumb or dangerous things. Their conscious areas of the brain are not fully involved at that point when they're sleepwalking. They're actually in deep sleep. Bedwetting also, if it occurs, is most likely to happen in non-REM 3. The person is less aware of stimuli, including internal stimuli that alert them that they need to get up and go to the bathroom. Now, we also have REM sleep. REM sleep stands for rapid eye movement sleep. Researchers found that at certain times during the night, the person's eyes would begin to dart back and forth as if they were watching a movie, eyelids closed. Okay. Brainwave patterns showed similar to waking consciousness, beta waves, so more rapid brain activity. They also found body temperature increased during this time. And if people were awakened during REM sleep, they would report experiencing dreams. Even people who thought they didn't dream would find at this point they were dreaming. Now, this REM sleep, also they observed that frequently genital arousal occurs during REM sleep. They used to think that it was associated with some kind of sexual dream, but in fact sometimes they found it was not. So this may be a way their body just circulates blood to that area of the body for maintenance purposes. People get the bulk of their REM sleep towards morning time, as we'll see on the next chart. Sleep cycles generally require about 90 minutes to be completed. And when the person first falls asleep, they will go through stage 1 sleep, not yet experiencing any REM sleep, and then into the deep stages of sleep. Oh, by the way, on this chart, this is based on an older classification of sleep cycles where non-REM 3 was called stage 3 and 4 sleep. So know that stage 3 and 4 is really just our non-REM 3. After the person goes through their deep stages of sleep, ascending into lighter stages of sleep, and then the beginning of the second sleep cycle would be the first episode of REM sleep, indicated here. Those REM sleep periods become longer as the night progresses each time around. And this in part accounts for why we get most of our REM sleep and dreaming towards morning time. The other thing that accounts for this is as we've gone through several sleep cycles, the person no longer goes into the deeper stages of sleep. Towards morning, maybe simply alternating between REM sleep and stage 2. Also accounts for why people are generally easier to wake up as it gets closer to morning time. What's not indicated here is that frequently people will wake up a number of times during the night for a few moments, usually somewhere associated with REM sleep, and then go back to sleep without ever being aware that that's happened. Our memory system doesn't capture that brief awakening that occurs. We should also note that people get most of their deep sleep early in the night as well. Now the question also comes up, well, why do we sleep? Why do we need sleep? We should note that sleep needs vary by age. Newborn babies sleep as much as 17 hours a day. On the other hand, the elderly sleep the least of any age group. Differences in sleep need from one person to another may be genetic. Some people just need more sleep than average, and some can get by on somewhat less than average. Although it seems that it's very typical that people do best somewhere around 7.5, 8.5 hours of sleep on average. But there are some people that They may need a couple hours more, may need a couple hours less. It varies. It seems to be potentially genetic. Now, another way to look at why we sleep is to look at what happens if we're sleep deprived. Studies of sleep deprivation vary greatly. Sometimes some researchers have kept people awake for days. In other cases, they simply wake the person up an hour early each day. So that said, what you see on this chart are what are the consistent results of sleep deprivation. People experience daytime sleepiness, feel fatigued, tired. It impairs concentration. They have difficulty concentrating, also interferes with memory, and problem solving becomes more difficult. People have difficulty learning new information. Students who suffered sleep deprivation demonstrated impaired academic performance. People also become more prone to accidents and making errors. Night shifts in factories, we find that they have less productivity than the day shifts, and also tend to have more accidents and make more mistakes as well. Sleep deprivation increases inflammation in the body and can lower our immunity and make us more vulnerable to illness and disease. It also influences a number of hormones that are released, such as ghrelin, cortisol, and leptin. The net result of that then is weight gain. So if a person is trying to lose weight, one of the things they should do is try to get adequate sleep. People who are sleep deprived also react more slowly, slower reaction time, and are at a higher risk for depression. If sleep deprivation is ongoing, the person also may experience premature aging. Now, you might wonder, well, just how do I know how much sleep I need? Is there any kind of test that you can take or anything? And so far, no. However, by some personal experimentation and observing yourself, you can determine whether you're getting enough sleep. If you're experiencing any of the symptoms listed here under sleep deprivation, you're probably not getting enough sleep. You should try increasing the amount of sleep for a while to see if that makes a difference. On the other hand, maybe you're not experiencing any of these kinds of problems, and you might wonder, well, do I really need as much sleep as I'm taking? You could decrease the amount of sleep and observe the results. If you start experiencing these sort of things, then you do need as much sleep as you previously were getting. If you don't, well, maybe you can do with less sleep. Now, sleep theories then try to explain what function sleep serves for us. One would be that sleep has a protective function, or did for our ancestors. In those days, people were subject to being attacked by predators at night, and were safer if they were hidden, inactive during the nighttime hours when they couldn't see as well as the predators. On the other hand, we humans can gather our food and hunt for food more readily during the day when we can see what we're doing. And so we developed, as a species, a pattern of sleeping at night and being awake during the daytime. The second theory would suggest that we need that sleep to help us recover and recuperate. While we're awake, we put wear and tear on our body and our nervous system, and we need to shut things down in order to recuperate and replenish. And there's some good evidence for that. There is a substance called adenosine that builds up in our nervous system while we're awake, which is broken down when we're sleeping. And we also know that many of the recuperative processes of the body proceed much more rapidly while we sleep than while we're awake. So there's some reality to that. And then you have also the theory that sleep may be necessary for memory processes, and indeed research indicates that we are identifying things to be remembered and locking in new memories while we sleep. It may also be important for creativity and problem solving. Our brain may be able to work on various problems and come up with new ideas while we sleep, maybe potentially also without the interference of conscious thought. And many people have the experience of waking up after in the middle of the night or maybe in the morning after trying to solve a problem and finding that they have discovered the answer to their problem while they slept. Growth hormone is released to a much greater extent when we sleep than when we're awake. And so growth and development is another reason, another function of sleep. If your mom or dad told you when you were a kid, yeah, you need to sleep so that you'll grow, there's some reality to that. Next, we look at sleep disorders. And these are significant disturbances in the sleep cycle. First on our list is insomnia. Insomnia is a persistent inability to fall asleep or stay asleep or to get restful sleep. And that's not just a night or two of trouble sleeping, but an ongoing pattern. If you are having trouble sleeping and you go to your doctor, your medical doctor, she asks you some questions and determines that indeed you do have insomnia, you will most likely as a treatment receive a prescription for some medication to help you sleep. And in part the reason that you get that treatment is because today doctors have not a lot of time with each patient, and so within that limited time often the most that doctor can do is make a prescription for you. Now that said, years ago doctors would sit down and they would have a talk with you if you had insomnia. What are you worrying about? Are there some things that you're doing that's keeping you from falling asleep? Indeed, most of the causes in insomnia are psychological or behavioral. Psychologically, it may be worry, it may be anxiety about unresolved problems that keeps the person from falling asleep. It may be depression that is contributing to the insomnia. It may also be that the person is engaging in certain behaviors that interfere with sleep. They may be taking long naps during the day and then find themselves having trouble falling asleep at night. Or behaviors such as having heated discussion with one's spouse right before bedtime might be also interfering with sleep. Behaviors of maybe drinking caffeine-laced drinks late in the evening could interfere. Or sometimes even just an association that is occurring between trying to sleep and stressful activities. Maybe the person always sits on their bed with their bills trying to figure out how they're going to pay all their bills. Now their nervous system associates being on that bed with anxiety rather than drowsiness. So my suggestion is that if you know anybody that suffers from insomnia, it's probably fine if they go to their medical doctor and get some medication to temporarily get some relief from that. But in the long run, they're going to benefit if they get together with a psychologist or a counselor who can talk with them and help them identify any underlying causes that are of a psychological or behavioral nature, and then work to change those things. That way they don't end up becoming dependent on medication long term. Second on our list is narcolepsy. Now, this is much less common than insomnia. Here, the person suffers from sudden and irresistible attacks of sleep, even when they're well rested. In many cases, those attacks seem to be brought on by strong emotions, whether that's a sudden scare or whether that is excitement. Even sexual excitement might trigger these attacks. When the person experiences these episodes of these narcoleptic episodes, they may fall directly into REM sleep, in which case their muscles will become limp and paralyzed. So if the person is standing up, they might simply collapse to the floor. If they're driving, obviously that could be very dangerous. The person then usually awakens within a few minutes, seemingly completely refreshed, but they weren't sleep deprived to begin with. This is something else. Now, they've found that there's a similar syndrome that dogs can experience. In dogs, it seems to be genetically related. They kind of think in humans also the causes of narcolepsy are probably going to be found to be primarily genetic as well. There's some medications that can make the attacks less likely to occur, but they're not 100% effective. Third on our list is sleep apnea. This is a relatively common sleep disorder, and here the person stops breathing for a time while asleep and eventually has to gasp for air in order to get enough oxygen in. Often the person is not aware this is happening, although it may be happening hundreds of times a night. Frequently they don't know until someone else tells them that, hey, you're scaring us, you don't breathe when you're sleeping. That said, people with sleep apnea often experience daytime sleepiness, difficulty remembering things. They frequently become accident prone. There are some very good treatments for sleep apnea. Sleep apnea, people who are overweight are at higher risk of this. And it turns out that if the person with sleep apnea is overweight, sometimes just losing weight is sufficient to relieve the problem. In other cases, that doesn't work, or the person's not overweight to begin with, then the use of what they call a CPAP mask that helps them to get the air in while they're sleeping can help them overcome this. And the person gets acclimated to wearing that and finds that they feel a lot better when they're awake. And if these things are not sufficient, then minor surgery can be performed to help open up the breathing passages so that when they're relaxed, the person is sleeping, that the obstruction to the breathing doesn't occur. So the good treatments out there for this. If you know anybody that has them, let them know that there's things that can be done. Night terrors. This is a sleep disorder where the person appears to be terrified while sleeping. The person might even sit up suddenly, eyes wide open. They might scream, they might perspire, heart might race. All of the indications of being terrified. This is most common in children. The parent may come to comfort the child and find the child is unresponsive to them. Eventually the child settles back down, and the next morning the child has no memory of anything at all happening. The parent, on the other hand, may be traumatized, wondering what's wrong with my child and what does this indicate. What research indicates is that these night terrors occur during non-REM sleep, during our deepest stages of sleep. And there is no dream that is associated with this. So this is not nightmares. Nightmares tend to happen towards morning. Night terrors tend to happen early in the evening when we get that deep sleep. Usually this is a matter then of maturation. As the person matures, the night terrors tend to taper off and eventually disappear in most cases, although there may be some people that still continue to experience this disorder even into adulthood. I've also listed sleepwalking here as well. We mentioned earlier that this, when it occurs, happens in the deep stages of sleep. It's usually harmless, but of course there are potential risks here. It's best if we simply guide the person back to their bed if they're sleepwalking. Now, it won't generally do any harm if we do wake them up, but it's pretty jarring to be wakened from deep sleep very suddenly, so we're going to suggest it's best to just guide them back to their bed. Sleepwalking also is most common in children, tends to taper off as people mature, and also tends to increase when people are sleep deprived. Here's a list of recommendations that psychologists would make for anyone that suffers from insomnia. They would suggest the person take steps to resolve worrisome problems and learn how to manage stress more effectively. Also, if they have depression or an anxiety disorder, to get some help with that. And exercise can be beneficial. Now, moderate exercise is best. All-out, exhausting exercise can actually interfere with sleep, so moderate exercise. And also, for many people, that exercise is best earlier in the day rather than in the evening. For some of us, that exercise will get us revved up for a few hours, so probably earlier on in the day is most beneficial. Also, keeping a regular, consistent sleep schedule helps. The body gets used to that schedule of going to sleep and getting up at a certain time. If we, on the other hand, are irregular in our sleep schedule, like a lot of people do, sleeping in on the weekend, going to bed late on the weekend, we may find that we're having difficulty adjusting and getting to sleep earlier and getting up earlier during the week. Also, avoiding long naps. Although short naps may not interfere with sleep, longer ones readily can. Relaxing, dimming the lights well before bedtime can also be helpful. And that would include dimming TV screens, computer screens, even exposure to the light of one's cell phone screen may be necessary for people that are sensitive to that. Also, taking in caffeine after mid-afternoon for some people interferes with drowsiness, so discontinuing that may benefit. On the other hand, taking a glass of milk before bedtime can help release serotonin that contributes to drowsiness. And so actually, if that's one of Grandma's remedies, there's a scientific reason that that can be helpful. And the psychologist would also suggest that we reserve our bed for simply sleep and sex. That prevents us from associating that with any anxiety-provoking activities. We should also turn the clock around so that we're not looking at that as we're trying to fall asleep. If we do, as we continue to notice that we still haven't fallen asleep and more time is passing, we get more and more anxious. The more anxious we become, the harder it is to fall asleep. And then lastly, they would suggest to us that realize you're going to be okay. You may have some times when you're not able to fall asleep readily, but your body is going to force you to sleep when it becomes necessary for your physical survival. So you'll be okay. Next, we take up the topic of dreams. And now that we have been able to link dreaming with REM sleep, we can study it more readily by waking up people when we see that they are in REM sleep. Now, if we want to recall our dreams, research indicates that there is about a 3-minute window of recall after waking from a dream. If we don't take note of it during that time, we likely will forget it. If you want to remember your dreams, keep something by your bedside to write with. Write it down as soon as you wake up. Otherwise, you're likely to forget many details of the dream, if not the entire thing. Now, research now has been able to also study what we dream about, and they found that most dreams involve some negative emotional content. As a matter, 8 out of 10 dreams, one or more negative events. Things like failures, being attacked, being chased, pursued, rejected, some misfortune occurring, very typical parts of dreams. In fact, there may be a good reason for that. Dreaming about these negative events might help us to prepare in case they ever happen, might help us to sort of work through how we would respond to those sort of things. So there may be a reason for that. Now, in terms of sexual content, they found not as common as many people might think. Men, only about 1 in 10 dreams contained some sexual material. In women, it was somewhat less, about 1 in 30 dreams. That said, women are more likely to have romantic type of dreams than men do. Most dreams contained also kind of the normal stuff from the previous day or two's experiences, and things that people were preoccupied, concerned with the previous day or so. So maybe we've run into someone, or we watched something on TV that might become part of that night's dream. Or if we're worried about a math test, we might find ourselves working math problems in our sleep. So just a lot of normal stuff from the previous day or two comes into that. Also, real stimuli in our environment can get woven into that dream. Maybe a fire alarm, our alarm clock becomes a fire alarm in the dream. Or if it's cold in the room, maybe we dream about going snow skiing or something like that. We do have some awareness of that outer stimuli while we dream. Now, to try to explain the purpose of dreams, back in the late 1800s, Sigmund Freud suggested that dreams are a way of fulfilling erotic wishes that we have. Freud suggested that we have unconscious sexual urges that would cause us great anxiety, that would be very upsetting if we recognized that we had those urges. So in order to fulfill those urges, we act them out in a hidden sort of way in dreams. So in the dream, the manifest content, the people, places, and events of the dream that we're consciously aware of represent the latent content, the hidden meaning of the dream. So we get to satisfy the unconscious or erotic wish without feeling guilty or frightened in a symbolic way in dreams. Now, maybe you're thinking that, I don't think dreams really have that much to do with sexual urges, and a lot of modern researchers would agree that rather dreams serve a purpose for processing information. And in this view, dreams may be a way of sorting through the events of the day or so before to identify what things that we should remember and lock in. And indeed, there is good evidence that memory consolidation goes on both during REM sleep and deep sleep, so we're locking in new memories. We also know that if we interrupt people's REM sleep, prevent them from getting that REM sleep. It inhibits memory processes. Now, dreams also might help us to extinguish various fears and cope with traumatic experience. When we face our fears, we often are able to overcome them. Those dreams that we have that are frightening may give us a chance to face our fears and become less frightened by those things. Dreams also may serve the purpose of developing and maintaining neural networks, forming new connections between neurons in our brain. One of the things that suggests this is the vast amount of REM sleep that newborn babies get. As you can see on the chart, they get nearly 17 hours on average, and we think all of this REM sleep and dreaming helps them to form new connections in their brain so that they can advance in their intellectual development. And notice that also makes sense as we have formed all of those synapses, we have less need to form new ones, and as we mature, then the need for REM sleep tapers off. Although you should also note that once we become an adult, the amount of REM sleep that is needed seems to stay pretty constant and consistent even into old age. So it appears that we need some REM sleep lifelong. A fourth explanation about the purpose of dreams is that it's our brain's way of explaining neural static, as our textbook calls it. Now, the idea is that stimulation from lower brain centers reaches the higher levels of our brain or cerebral cortex, and when it does, it randomly stimulates the experience of various thoughts, various memories, and various emotional states. And because these things are random, they don't make sense. But our brain is always looking for patterns in our experience, trying to make sense of things. And so what our brain does is it then fills in to make a meaningful plot out of all of this random material, trying to make sense out of it. And so you might say, according to this explanation, to some extent the source of dreams are biological, and in other ways they may be personal, and they may indicate something about ourselves by how we fill in the missing elements between those random events. One thing we can definitely say is that we seem to have a need for REM sleep. If we deprive people of REM sleep when they have the opportunity, they will engage in significantly more REM sleep, seemingly trying to make up the lost REM sleep. We don't seem to make up any missed deep sleep. Again, this suggests that the REM sleep is even more essential than deep sleep in some ways. So we'll stop there, and I'm going to pick up the rest of the chapter in another video. So do make sure to also look for part 3, and we'll go from there. Thanks. Bye-bye.